A winter that staff say has been year-round. Crowded hospitals even through the summer, historically long waits for treatment. And today, the unwelcome headline figure that revealed that October had the worst ever A&E performance since the target was introduced in 2004.
Where we think the problem is that the NHS is essentially underfunded and it's understaffed. So there are at least 40,000 nursing vacancies at the moment. We know that GP numbers are far below where we need them to be if we're going to be able to deliver the care that we want to be able to deliver. And to do that, we also need more money for the NHS.
NHS England's performance monthly data shows that fewer than 84% of patients who arrived at A&E were treated or admitted in 4 hours. The target is 95%. And more than 720 patients waited over 12 hours for a bed in October. That was a 60% increase from September. It was always anticipated that these figures were going to be bad. The problem, of course, is that they're in the middle of a general election. Yet what this data doesn't show you is the pain and suffering that some of these patients have to go through as they wait for their operations or sit on those chairs in A&E. Catherine Manning, who has rheumatoid arthritis, spent 6 months waiting for a hip replacement. Why were you so desperate?
Because it hurts. The pain and the fatigue. I was falling over on a regular basis. Almost daily I was falling. I needed help just to get dressed in the morning, and just being a mum, I couldn't do the general things that I just wanted to do with my children, just like going out, school run, because of the pain.
Was it hell?
Yeah. And I don't ever want to go through that again.
NHS England is currently reviewing all the targets, possibly scrapping some of them. But today the Royal College of Surgeons and the charity Versus Arthritis wrote to the 3 main party leaders, urging them not to abandon the one for 18-week planned and elective surgery.
They plan with their surgeon for a long time, for many years, when is exactly the right time to have the operation. And often they're desperate because of the pain. For that to be snatched away from you just when you think you're going to have the operation as a massive psychological blow. But also we know that if you delay a joint replacement, it can also affect your physical health.
The Conservatives actually wanted today to be about immigration, but it was the NHS that dominated.
What these figures show is the huge pressure that there is on the NHS caused by demand. And that's why we're making colossal investments now in the NHS. Just since I've been Prime Minister, £34 billion programme.
Yet immigration and the NHS are linked, not least because it's reliant on bringing in overseas staff to fill the gaps.
The NHS now has 40,000 nurse vacancies, has the longest waiting times in history, has the longest queues for A&E departments, and very large numbers of people waiting for operations, often because of staff shortages brought about by us not recruiting enough overseas doctors or nurses. We've got to be realistic about the needs of our economy for bringing workers in, skilled workers in to help us.
What was striking about today's figures was how widespread the problems were. 23 trusts had patients waiting more than 12 hours on trolleys. The highest numbers were in Stockport with 63 patients, Cornwall with 59 and Lewisham with 52. Yesterday, Labour outlined its plans for England's NHS, pledging £6 billion more than is currently promised by the Conservatives, though they and the Lib Dems have yet to unveil their health manifestos. But whatever money comes post-election, it is too late now to avert what is likely to be one of the harshest winters in recent times for the health service.
Well, we did ask for an interview with Matt Hancock, the Health and Social Care Secretary, or one of his junior ministers, but no one was available. Joining us now from Leicester is the Shadow Health and Social Care Secretary for Labour, John Ashworth. How quickly would a Labour government meet these targets once again?
Well, can I just say, isn't it absolutely heartbreaking what we're hearing about the state of the NHS under the Conservatives? The worst A&E performance on record, and so many people, often elderly people, often people confused, sometimes with dementia, languishing on trolleys for hours and hours and hours in busy, overcrowded hospital corridors. I mean, this is heartbreaking stuff.
But when would you turn it around?
we've got to really turn this around. Well, look, you know, we're going to put an extra £26 billion into the National Health Service, or on the calculation that Boris Johnson prefers to use, it would be £40 billion extra under Labour. We want to see that 18-week target, which the Royal College of Surgeons and others in your package were saying should be kept. We want to keep that target, and we want to see patients getting their operations on time.
Yeah.
I'm not going to
third
lie
attempt, John Ashworth.
or kid the
I've
British...
asked you, when will you hit these targets? When can you tell voters,
well, I
we'll get this sorted out?
Because I'm not going to I'm not going to kid voters. I'm not going to lie to voters. It's going to take some time to turn this juggernaut around. I'm going to be honest with voters on that, because after 10 years, a decade now, of cutbacks, cutting over 15,000 beds, I don't think the voters would believe me if I said, don't worry, it'll all be turned round on December the 13th if you elect a Labour government. I'm not going to lie to people. After 10 years of driving the NHS into the ground, it's going to take time to turn this around. But Labour governments have done this in the past. We inherited record waiting lists in 1997, and of course, by the time we left office, we had some of the highest satisfaction ratings on record and the lowest waiting lists on record.
But it's about how now, isn't it? Because but both you and the Conservatives are pledging a lot more money for the NHS. You're pledging a bit more. And the question is how you're going to do it. You are also saying NHS staff will move to a 4-day week over time.
No, we're not saying that.
How much will that cost?
We're not saying that.
Well, that's what the Shadow Chancellor said. Over 10 years, the NHS staff will also be part of his target to reduce working hours to 32 hours a week. That's going to have a cost for the NHS, isn't it?
That is not. We are not imposing a mandatory 4-day week.
I didn't say
on
that.
the NHS. Just let me explain this. Well, let me just explain the position on this, because I know the Conservatives are trying to make out there'll be a 4-day week in the NHS. It's utter nonsense. It's actually a lie from Matt Hancock, I'm afraid. I don't like using that word, but it's actually a lie from Matt Hancock. What John McDonnell is talking about is that over time, seeing if we can the national average of wage hours in the economy, which is around 37 hours at the moment, whether we can bring that national average down across the whole economy. Obviously, when you're calculating the national average of working hours in the UK economy, the hours worked in the NHS will be part of those calculations. That is a different position from imposing upon the NHS, or indeed any sector in the economy,
but obviously,
a mandatory
some NHS
4-day
staff
week.
will have their hours reduced if they want to, won't they, over a period of time? I mean, it would be absurd to exclude 1 million workers in the United Kingdom from this new target of yours. So, I mean, it will affect some NHS staff, and that will have a cost. Have you factored that in, is what I'm saying?
If in 10 years' time, if productivity is such and advances in automation and technology are such that when we go into negotiations with staff trade unions, and staff trade unions say, actually, the current contracted 37.5 hours we think could change, then that is something that any responsible employer would negotiate with staff, as happens at the moment, of course, in negotiating with NHS trade union staff about their terms and conditions. Okay. But at the moment in the NHS, you've actually got staff working beyond their 37.5 hours under the Conservatives, because the NHS has been pushed to the brink.
Look,
but this point this suggestion, this allegation that there'll be a mandatory 4-day week in the NHS.
Well, I haven't said that at all.
Nonsense.
You're kind of denying.
I know you've not
something
said
that other people may have said. Just finally, I mean,
yes, I'm denying what Matt Hancock has suggested.
Look, one of the biggest challenges, as you know, is recruiting staff. There are 100,000 staff vacancies in the NHS.
Yes.
And a lot of people are going to have to come in from abroad to fill those jobs. Are you going to do anything to make it easier for people from other countries to come in and staff the NHS as they have historically?
Yes, I am. I'm going to do two things. First of all, I'm going to bring back a training bursary for nurses and midwives and allied health professionals. So people in Bury and Bolton and Mansfield who want to train to be a nurse or a midwife, they'll be given the opportunity to train and come and work in our NHS. But I'm not going to say to hospitals who believe that if they found a surgeon or a nurse from abroad, if they believe that surgeon or nurse is qualified enough to care for our sick and our elderly, I don't think we should put hindrances in their way. So I believe the NHS should be able to recruit internationally, and under a Labour government, they will be able to recruit internationally.
Jonathan Ashworth, thank you very much indeed.
Thanks, Krishnan. Well, joining me now is Dr. Charman Nagpur, Chair of the British Medical Association. Thanks very much for joining us. You heard there from the Shadow Health Secretary. We heard from the Prime Minister earlier saying that the pressure is actually caused by demand. What's the truth here?
I think it's really unfair to be blaming demand or patients about the pressures in the NHS. The simple fact is we simply don't have the infrastructure compared to other leading European nations. We are tens of thousands of beds short compared to France and Germany. They have twice as many. We have far too few doctors. We have far too few social care facilities. GPs in the UK see patients at the shortest intervals in the whole of Europe at 10 minutes. So we actually don't have the system, the infrastructure, the people to provide the care that the public need. So it's not fair to blame it on patients or demand.
Can you give us a sense of what it's actually like for your members in these hospitals having to make decisions every day?
So doctors want to do their best for their patients. And it's actually really quite demoralising for doctors to be unable to provide patients with the care they want. So if you're actually working in a hospital setting, to actually see patients waiting 12 hours in a trolley is actually, you know, it goes against everything we stand for and what we want to do. And there are 30,000 more patients waiting in trolleys now compared to this time last year. So the situation is really worse than we've ever seen before. Similarly, in the community, GPs are seeing patients who should be in hospital, who should be provided with proper care. They want to have the facilities and time. They cannot do so. We also have problems in social care. 5,000 patients are occupying beds where if we had these facilities for them to be cared for in the community, they could vacate. So it's actually a complete whole system pressure that's resulted in what we're seeing at the moment.
I mean, both the major political parties are pledging to spend more cash. Is that enough? Do you think our political leaders have got a grasp of what's going on?
I think if we just hear headline figures. What we need to understand, and everyone needs to be hearing from politicians about how they will actually spend that money, how that will translate into differences. So, in fact, if we know that we need 10,000 more doctors, how will that be achieved? Just saying that we'll put more money in and somehow something will be magicked up isn't the way to run the health service. The other thing is this isn't a winter crisis, because we've been hearing about the BMA identified 2 years ago. What we actually have is an all-year crisis. We're seeing summers that actually have greater waits than previous winters. So we need to fix the NHS, not just fix winter.
OK, just very quickly, how long would it take realistically to turn this around? Well,
it's going to take several years because we've had 10 years of underinvestment, austerity. But what we can do is some immediate measures. And I'll just give you one. Doctors at the moment are being prevented from working extra hours. Many are actually not leaving the health service because of some punitive tax rules. We need to just scrap those. We need to take away the barriers that prevent doctors from overseas coming to work here. And there are charges that we incur for them to come and work here. So there are things that can be done immediately, as well as longer term.
A lot more to talk about, going to have to leave it there. Thank you so much for coming in. Krishnan.
Well, 4 o'clock today was the deadline for candidates to submit their names to stand in the election. But one prominent Brexit Party MEP, Rupert Lowe, waited until 1 minute to 4 to announce that he had decided not to contest the seat of Dudley North after all. So what's going on with the Brexit Party? Our political editor, Gary Gibbon, is in Westminster now. Gary.
What appears to be going on is, with that deadline approaching, the Conservative Party right at the top decided that it should have a concerted effort, a bombardment really, of Brexit Party candidates to try and get them to stand down. There have been emails, phone calls. Nigel Farage is furious about this, as you're going to hear in a minute, and he is alleging that amongst the things that have happened in these phone calls is that senior people in the Conservative Party have been suggesting that these Brexit Party candidates, if they do the right thing, might just get a job. It's been suggested one of the jobs being talked about was in the negotiating team for the free trade agreement after Brexit, might even get peerages. And he's absolutely furious about that. And he's also furious because they seem to be playing the Conservative Party here on what is a mutiny in bits of his own ranks, because in addition to the potential candidate you were just talking about, at least 2 other Brexit Party candidates appear to have decided not to put their nominations in at the last minute. Is, as I say, making Nigel Farage extremely angry, and you get a flavour of that in what he just said here.
Extraordinary day. A mixture of threats, thousands of phone calls and emails to prospective candidates for the Brexit Party telling them not to stand, because the Conservatives should stand alone in these seats. Some of them civilised phone calls, many abusive and threatening. And then the other side of the coin are inducements. Even people in number 10 Downing Street ringing our candidates, promising them jobs and Christmas baubles if they don't stand. Now, if that's not political corruption, I don't know what is.
And Nigel Farage even named who he said was one of the people in number 10 making these calls, the senior aide to the Prime Minister, Sir Ed Lister. And this isn't being denied by Conservative Party sources. What is being denied is that any jobs or peerages were offered to anyone. Will any of this have an impact? Well, Nigel Farage talking badly about the Conservatives and Boris Johnson, just when Boris Johnson is trying to get Nigel Farage's voters into his column, could actually play badly for the Conservatives over time, but we're a few weeks away from that. One other story that is going around tonight that will also contribute to lurid headlines, by the way. The European Commissioners turned around to Britain and said, because we've extended our membership, because we couldn't hit the Brexit deadline, we're still meant to be good members, playing by the rules, and we're not doing that by not nominating a European Commissioner. And they've sent a letter to the government tonight effectively saying, we might just sue you. You could be fined by the European Court of Justice.